So if you or someone you know is feeling sick, Erie News Now's Megan Selensky is live at our alert desk this morning with more on how to differentiate between the illnesses that are going around these days and when exactly to know how to know exactly when you should be asking to go to that doctor's office. Good morning, Megan.
Good morning. Well, Mark, Tracy, the holidays are officially over, so are all of those gatherings. But if you went to some of those large gatherings, you might be waking up this morning with an after Christmas present, and it's not one many want. So what do you do if you're waking up feeling sick post-holiday season? Erie News Now medical correspondent Dr. Becky Dawson tells us that knowing which virus you are sick with is only necessary if you are in need of treatment.
So if you're starting to get symptoms that are unmanageable, or you are an individual who's at high risk for more severe symptoms, it is advantageous to go and get tested.
Each year, there is a surge in respiratory illnesses after the holidays. Around our region, healthcare providers are seeing an uptick in cases of COVID, flu, and RSV.
We're seeing both in the primary care offices at AHN St. Vincent, but also in the emergency department and throughout the hospital. We are definitely seeing an uptick in respiratory illnesses for sure.
Lately, the three viruses that have been affecting us the most are RSV, flu, and COVID.
When we do start to develop symptoms, many may be unsure on what to do next. When is it okay to stay home? Where do I go to seek treatment?
More serious symptoms generally correlate with a need for going to an emergency department. So anyone that's experiencing chest pain, shortness of breath, symptoms that are getting much worse, not responsive to over-the-counter treatment options, symptoms that are going on for a long time, those tend to be the conditions that warrant an emergency visit. Someone is just starting with symptoms, someone who has minor symptoms, it's definitely recommended that they call their primary care physician or utilize an express care or an urgent care.
By calling your primary care doctor first, you will help reduce those wait times in the ER. But if you are having long-term symptoms or are at high risk, it is important that you do go seek emergency care. And of course, continue to stay at home if you're sick and wash those hands. From the Alert Desk, Megan Selensky, Erie News Now.